Hello, my name is Dr. Isaac Muberry. We're going to be talking about the thyroid, the different triggers for the thyroid, how to test for these triggers, and how to actually find ways to get healthy instead of just medicating these problems with the thyroid. We're going to be diving into this. Just a little bit about me, though. I've been a chiropractor for 18 years and practicing holistic health for 18 years. So let me share the screen here and we're going to get going on the thyroid. So let's see, slideshow from beginning right there. All right. So just as a little bit of a background here, there's a ton of chronic health conditions, and so many people are frustrated and burned out by the current system that they feel like they're spinning their wheels. They're not getting answers. They're told their test results are fine. They still don't feel good. They have fatigue, bloating, their hair's thinning. They have dry skin, weight gain. They don't feel good, and they don't know where to go. And just for an example, uh, right here, chronic disease affects 1 out of 2 Americans and causes 7 out of 10 deaths. It's an estimated 76% of adults and kids have a chronic health condition right now in the US. Over 100 million Americans, nearly 1 in 3, have prediabetes or are diabetic. 1 in 4 children now is labeled as being on the autism spectrum, up just from 1 in 500 in 1999. So things are definitely going the wrong direction. We're going the way of the dodo bird if we keep going the direction we are heading currently. According to the American Heart Association, HMOs spend more money on adverse drugs than they do than on adverse drug reactions than the drugs themselves. Starbucks spends twice as much on health insurance than on coffee beans over the last 12 years. According to Yale University, 25% of your health is genetic and 75% is lifestyle choices. And then we're going to talk about that more in just a little bit. Now, what is the leading cause of disease? This is a great point to ponder. If you understand this, then this is going to get you going in the right direction to find your triggers and help change the health trajectory for yourself or loved ones. The leading cause of disease is inflammation. And Time magazine came out with an article in 2004 linking inflammation to cancer, Alzheimer's, and other diseases. So we've known about this for a long time, but we get put on too many anti-inflammatory medications and they're not finding the trigger, what's causing the inflammation, which we'll be talking about here shortly. So now we're going to talk about thyroid function. What is it responsible for? It helps with our breathing, heart rate, heart health, how quickly your heart rate happens, if it's slow or fast, inflammatory markers such as CRP, cholesterol levels, controls or helps regulate the central and peripheral nervous systems, body weight, muscle strength, the menstrual cycles, hormones, body temperature, digestion, bone health, development and IQ, and the immune system. So just for an example, some of the most common symptoms of hypothyroid, which is more common than the hyperthyroid, but trouble sleeping, tiredness and fatigue, difficulty concentrating, dry skin and hair, depression, constipation, sensitivity to cold temperatures, frequent and heavy periods, joint and muscle pain. One of the more common medications people get put on, however, is Synthroid. And some of the side effects you'll see sound similar to the very symptoms of hypothyroid, but you have headaches, sleep problems, feeling nervous or irritable, fever, hot flashes, sweating, pounding heart, or fluttering in your chest, changes in your menstrual cycle, appetite changes, and weight changes. Some of the same reasons that people come into a medical doctor hoping to get some results for what their symptoms are, but get put on a medication that has the same side effects as the symptoms of a thyroid problem. So now on the hyperthyroid side, hypothyroid could be a sign of possibly an autoimmune condition such as Hashimoto's, and the hyperthyroid could be related to an immune condition called Graves' disease. Sometimes it can actually fluctuate back and forth. But here's some of the signs of a hyperthyroid: trouble sleeping, restlessness, rapid heart rate, anxiety, irritability, sweating, tremors, loose stool, weight loss, weakness, thin hair and skin, heat intolerance. So when we look at the thyroid, what is going on here? How is it what's the process in our body with hormones to communicate with our thyroid to tell it to release uh, the different hormones? So up in the hypothalamus, which is in your brain, we have the thyroid releasing hormone that gets produced. It signals the pituitary to produce TSH. TSH comes from your brain. It does not come from your thyroid. So a lot of times the TSH is the gold standard in Western medicine to identify if there's a thyroid problem. But the problem is they're testing your brain, not your thyroid, actually. So what happens from there, though, is that TSH hits the thyroid, causes the thyroid to release T4, which then gets converted to T3, oftentimes in the liver. And then that T3 signals the pituitary, hey, we have enough hormone now. So then it decreases the amount of the TRH, the thyroid releasing hormone. And so then you have less TSH. It's a continuous cycle. So your body's always communicating it with itself. And obviously, we have different demands throughout the day. And this is cyclical. It's not just a continuous, like steady amount of TSH or TRH, T4, T3, that's present in your body. It fluctuates throughout the day and throughout the month. So we want to like really dive in and give you a better understanding of the fireman medical approach, which there's a time and place for, versus the carpenter, the wellness way approach. And so one of the best ways to illustrate that is just a simple point here of like, I'll use the example of a heart attack. If I have a heart attack, I want a fireman. I need medicine, drugs, surgeries, cut me open, save my life. That's exactly what they've been trained for and where they excel. But what led to that heart attack, that's more of where a carpenter comes in after maybe the fire's been put out. You need to figure out what caused that heart attack and address those factors, not with necessarily medications, but you need to find the triggers contributing to that inflammation and that stress that led to that heart attack. An example here with the thyroid, here's the difference. You have the medical approach, they're gonna, like their lab tests are mainly looking at TSH. Like somebody like Dr. Oz, maybe more of an alternative medical approach, is gonna look at TSH, T4, and T3. But the wellness way approach, we're gonna be looking at a full thyroid panel, which usually has at least 9 markers on it, which we'll talk about here in a little bit. But we want to figure out the why. Why is this happening? What are the triggers? What caused it, right? And then if we can figure that out, then we can come up with a plan to figure out how to fix it. Did you know that there are 6 hormones made by the thyroid gland? The T4, T3, reverse T3, T2, T1, and calcitonin. So Synthroid, for example, how could that replace all of those? It's only really designed to try to mimic one of these. So let me tell you about Tanya. She came to us after going in to see her primary care and being on levothyroxine. She'd been on for over 10 years. She was feeling fatigued. She couldn't lose weight. She was dealing with this weight loss or weight gain that she couldn't just lose. And she'd been eating well. She'd been exercising, and still things were stuck. If we look at the TSH, they were right when they told her, hey, your TSH levels are fine. I keep taking the medication. There's no other problems. But the thing is, they'd only been measuring your TSH. This is all 9 of those markers I alluded to about the thyroid that needs to be done so you can identify how the thyroid itself is actually working. What I really want to highlight, though, is this thyroid peroxidase antibody. So this is actually appearing that she has more of an immune problem than a thyroid problem, actually. And her thyroid's suffering because of the immune issue. Her immune system is attacking her thyroid. And so we need to identify what were her immune triggers. And a lot of these were actually in her gut. So after we started working with her and addressing her gut health, she's within 2 months, she started to lose weight. She was feeling more energized, and she was feeling the best she had in over 10 years. And obviously she was frustrated because she was like Why did they not do these tests for me? There's different possible reasons. I don't want to get into those, but I understand the frustration when people come in. They're like, why didn't they test me for this? Because it is just within the normal thyroid panel. This isn't like necessarily special testing. It's just that the provider has to order it, so then you know what's going on. So then you can make better decisions to help guide yourself with what would be right. Now, those four areas that you need to take into consideration with the thyroid hormones and just thyroid function overall. Okay, you need to make sure your body has enough of what it needs to be able to produce the hormones that it's trying to produce. Also, you need to make sure your body has what it needs to be able to convert T4 to T3, for example. But then there can be some other factors to consider. Is the thyroid being destroyed? Is there an immune problem? Or is there interference that's triggering the thyroid problem itself, which we're going to talk about here. So now, production. There's different minerals and vitamins that are needed for optimal thyroid hormone production. You're going to see over here, the nutrients that are needed are going to be iron, iodine, tyrosine, zinc, selenium, vitamins E, B, C, and D. One of the more common things we'll also see with thyroid problems is that, especially women, they're more prone to anemia. And one of those needed elements is iron, which is trying to be absorbed through the digestive tract. And if there's gut problems, it's going to prevent that normal iron absorption, and that can lead to lower ferritin levels in the body potentially, which ferritin is like a bus for your thyroid hormones to be able to get transported around the body to where it needs to go to be able to be converted. So if you don't have enough iron and you have anemia, that's going to potentially cause some significant problems with thyroid hormone production. Now, conversion. Here's what you need for optimal conversion. You're going to notice that iron again, but then you have zinc, selenium, and glutathione. But where does conversion happen? A lot of the conversion actually happens in your liver. Now, destruction. And this, what we've seen is autoimmune conditions, especially Hashimoto's, but hypothyroid issues impact women at least 9 times more than men, at least in the US. But what's the leading cause of death for women ages 20 to 40? It's actually an autoimmune conditions. That's the leading cause of death for women between 20 and 40. Now, autoimmune thyroiditis, what's triggering the immune system that results in the destruction of the thyroid tissues and elevated antibodies. The antibodies would be thyroid peroxidase antibodies and thyroglobulin antibodies. Antibodies are formed in the thyroid gland and destroy the thyroid function. So here's just an example of this person back in 2015. Okay, so if we only measured their TSH, free T4, and free T3, you're going to see they actually look like they're within normal limits. But what wasn't revealed on this is that they had an autoimmune condition. So this could get passed off even though they're experiencing symptoms and signs of a thyroid problem. Their TSH and free T3, free T4 are within normal limits. They missed the immune problem, the autoimmune challenge this person was dealing with. And so that was back in October 2014. Now, fast forward to May of 2015, you can see that things are still within normal limits with those 3 markers, but their antibodies are decreasing. So their body is actually improving its function, and there's less immune triggers. Now, these autoimmune conditions can actually go into remission. It can definitely take some work, but we have to identify those triggers. So some of the things that can block iodine, especially with hypothyroid, iodine is oftentimes deficient, but many times hypothyroid problems, about 90% actually, are actually more of an autoimmune problem. If it is a true hypothyroid issue, iodine is usually the nutrient that is missing from a person's diet. So, but what can compete with iodine are the items above it. So you have fluorine or fluoride, chlorine, and bromine. Where do we find these though? We'll talk about that here now with Teflon, coated nonstick pans, Prozac, Praxil, other like antidepressant medications, antacids, antibiotics, and antihistamines all can contain fluoride. Wineries oftentimes also will use fluoride-based pesticides in their vineyards. So that's one reason why it would be an ideal scenario if you are drinking wine to make sure it's organic. So something that you'll notice that can happen on your teeth, you can get white spots on your teeth if you have fluorosis, which would be too much fluoride in your body. Now, bromine. This is the bully of the halide group, which is that group of elements where fluoride sits along with iodine. So oftentimes there's bromine added to flowers as a conditioner. Also pesticides, especially strawberries. And that's a good reason to avoid traditional strawberries and make sure you only get organic strawberries. But also soft drinks such as Mountain Dew, Gatorade, Sundrop, Squirt, Fresca, and other citrus flavored sodas will use bromine as well. And it could be brominated vegetable oils. Medications also can contain bromine, and you'll see the names right here with Atrovent, Atrovent spray as well as an inhaler, probenthine, and anesthesia agents. Fire retardants are oftentimes contain bromine, and that is like on your furniture, maybe in your beds, clothing potentially, but it also can be used in hot tubs and pools. So there's Mountain Dew. Now chlorine, obviously chlorine is used in household water in like the water systems. Drinking water, swimming pools use chlorine, but that can be, all these are competing for the same binding sites of iodine. So if you have too much of this stuff, iodine is not going to be able to get absorbed and utilized by your thyroid. Now, there is a video on YouTube called the smoking tooth video. A person had these silver fillings in their mouth and had a root canal done with that silver amalgam, which about 50% is mercury. They exposed that tooth to the same temperature as hot coffee, and you can see mercury vapors coming off that tooth. So if you have these silver fillings, mercury is definitely going to compete for the same binding sites as iodine. So you need to make sure you try to get those taken out. If you can, you ideally go to a holistic dentist where they're going to use some uh, different means to help make sure that when they're extracting that filling, that mercury does not get absorbed into your body. Here's just a little bit on thyroid hormone and its relation to lead and mercury and cadmium. And so you'll see that there's an adverse association, a negative association between mercury and thyroid hormone levels. So we definitely don't want that to happen. Now, selenium actually is really great because mercury actually will impair selenium activity, and it will bind to the enzymes that are needed. So, but the thyroid can't function normally without selenium. So that's where like mercury will actually bind to the selenium, which is needed for the thyroid. And so if we're having these challenges, we may need extra selenium in order to combat those toxins in our environment. Now let's talk about the interference, okay? Factors that inhibit proper function of the thyroid hormones. Stress. Now, who's not under stress? I hope nobody puts their hand up because we all have stress. We have good stresses, we have bad stresses, and sometimes we don't even realize that we are stressed and that's causing us problems. But infections, trauma and radiation, medications, fluoride, and as we just were talking about, bromine and chlorine, pesticides, mercury and cadmium, which would be like metals, lead, autoimmune disease. One autoimmune disease can lead to another autoimmune disease. Sodium, too much sodium, leaky gut, vitamins and mineral deficiencies. These can lead to interference. Now, here's a contraindication that many people that are on levothyroxine are totally unaware of, and their medical provider who prescribed that to them most likely didn't even do the right test for this. But levothyroxine is contraindicated in patients with uncorrected adrenal insufficiency. Have you had your adrenal glands tested? And you can't just necessarily base it off of one like blood marker. You usually need to have a cortisol mapping done throughout the day so you can see what the pattern of that cortisol is to see if there's a state of insufficiency or not. Now, why does this matter? Well, there's something called the hypothalamus pituitary adrenal axis, which is very similar, as you'll see in the structures here, to the hypothalamus pituitary thyroid axis. They both can lead to metabolic changes. And so they're very similar. And that's where cortisol is so important to know how it's functioning right here, because it can actually interfere with the hypothalamus pituitary and alter what the thyroid ends up doing. Here's an example of a cortisol stress test throughout the day. So you can see the blue area would be ideal. And we want to be somewhere between the blue, or sorry, the red and the purple lines. Okay, but this blue area is the most ideal. And the higher red line is going to tell us where chronic stress area would be. And the purple line is going to give us a better idea of where adrenal fatigue or insufficiency would be. So here's somebody that wakes up early, probably early in the morning, maybe 2 or 3 o'clock in the morning. They have high cortisol, but then it crashes throughout the day and they're exhausted and they can barely uh, stay awake throughout the day. So they're exhausted in the middle of the night, but they wake up early, right? That's what this pattern oftentimes looks like. Here's another person. Okay, you can see the cortisol right here super low throughout the day, but right over here, they're actually within that normal limits. And this person probably is feeling exhausted throughout the day, but then at nighttime, they actually feel like they can be more productive and get things done, so they stay up late. This is called the Dutch test, this particular test that we're looking at here. And here's another part of the Dutch test. The reason why these are important is because the thyroid can actually influence hormones. And we'll see this is a urine hormone test. And you need to do this test or blood hormones, especially sex hormones, between days 19 to 21 of the female cycle. But right here, you'll see the different estrogens. The green area right here between the two yellow stars is within normal limits. Same thing on all these other dials. And so right here, the green area is for a cyclical woman, the purple area is for a woman in menopause. And you'll see that two of the estrogens are pretty darn low. One of them is actually super high. And the other thing we'll see down here are three different pathways, the blue, red, and green pathways. The green pathway is a protective pathway. The red pathway that builds up too high will actually lead to DNA damage. And so that's something that could lead to breast cancer or other reproductive cancers, especially in the estrogen-based world. So this is a super important test to be done. I think it can actually be even potentially more impactful and protective than an annual mammogram. Let's see here. So what triggers the immune system? We're going to look at some different immune responses. Excuse me. So I hope this is resonating with you all and you're learning something as we're going through this. But right here, we have different reactions in the immune system. We have one that's called an IgE-mediated release of histamine, okay, and other mediators from mast cells and basal cells, which are types of white blood cells. Then we also have this type 2 reaction, which is called an IgG or IgM mediated response in the body, another type of white blood cell response. And there's a couple others, type 3 and type 4, but I want to really actually talk about this type 2 and the IgG here on this next one. But these are essentially creating cytotoxic effects on living cells, which means it's a toxic effect on the cells. If you imagine if your cells are dealing with toxicity at a frequent level, they're going to get stressed. They might even start dying. That could even turn into the body attacking itself. But here's an example of the IgGs. You're going to see right here, this person had 19 IgG blood food allergy IgG reactions. These are allergies, okay, not sensitivities, but these are allergic reactions. And you'll see some very common things, but beans are on this list, broccoli, even cashews, cabbage, eggs, milk, wheat, yeast. So there's a lot of common things here that people are consuming that this person was actually allergic to, causing this cytotoxic reaction in their body and inflammation. And this will really stress the thyroid out. So leaky gut. On x-rays, you can see signs of inflammation. If you see all these dark areas in here, this is a sign of bowel inflammation. So we don't know exactly just from the x-ray what's causing it, but it could be anywhere from bad bacteria, yeast, parasites, mold, maybe even those food allergies they're just talking about. But would be a sign of bowel inflammation that needs to be further tested to figure out what the triggers are. Okay, do you have to give up gluten? That's definitely very common nowadays where people are gluten free. But what happens is gluten actually impacts zonulin, which is important for maintaining the barrier in the gastrointestinal tract. And so gluten will actually interfere with that and can lead to leaky gut. And we'll see a little bit more information right here about leaky gut, but there's only two recognized stimuluses that open the doors for leaky gut or gut leak, gluten and bacterial imbalance of the GI. Leaky gut is now viewed as a precondition to autoimmune diseases. I mentioned earlier that about 90% of hypothyroid conditions are actually Hashimoto's. They just have not been tested yet to be diagnosed with that. So, especially now over the last 4 or 5 years, there's been an increase of a dramatic increase in autoimmune conditions. So, if you have a thyroid issue or even subclinical hypothyroid, which would be anything above 2 for a TSH, that's going to be an indicator that that person is most likely expressing signs of a hypothyroid condition that's subclinical. So they can have all the conditions or symptoms of a thyroid condition, but it's just the subclinical level that still can be addressed and doesn't necessarily need to have medication for it. Now, here's Claire. She was dealing with a lot of brain fog, fatigue, weight gain, as well as she was experiencing thinning of her hair. So you can see this blood food allergy test right here and all the different foods that she was reacting to. She needed to start avoiding these as soon as possible so that she decreased that inflammatory burden on her body. She needed to decrease that cytotoxic effect on her body. The other test we did with her was a GI map test, and this is just part of it. This is, I think, page 3 or no, 5 or 6 of the report, but you'll see these additional bacteria. You don't want to see any of these. The same thing right down here. This is yeast. You don't want to see these yeast that are present either. These bacteria are actually good ones, these top 3, if they're present. So right here, when it's in the yellow areas, that's a sign that these are a potential pathogenic infection. And we need to address this because these will lead to a leaky gut if it's not addressed. Now, one thing that is very common is that if there's a thyroid problem, only the endocrine system gets addressed because of like levothyroxine, that's impacting the thyroid. And that's the endocrine system. Endocrine system is your hormone system, okay? But what we're looking at here is more the whole body effect, okay? The last 2 tests we looked at was the blood food allergy test and the GI map test. Both of those are evaluating the digestive system primarily, okay? But if this is a Swiss watch, what happens if we bend just one little prong on a gear down here? What happens to the body or that watch? It can throw the whole time off. It could even seize the watch up and won't stop working altogether. That's how we look at the body. We're made up of different systems. Each system can impact another system. So if we start taking stress off of one system, decrease inflammation, and positively can benefit all those other systems. So that's how we're looking at the body and how we're using a different lens to be looking at what's triggering the problem of the thyroid. It's not just an endocrine system problem. There has to be a trigger happening somewhere. We need to identify that trigger. And that's where testing helps to identify. So now we have TSH, just a few bits of information on some of these different thyroid markers. It's a pituitary hormone, a very general overview of thyroid function. But again, it comes from the pituitary. It does not come from the thyroid. Ideal range would be 0.5 to 2, okay, for the TSH. It can tend to increase as the body heals. So if you're going through a healing process, your TSH levels may start increasing. This is similar to cholesterol for lipid panels as it would be for thyroid function. It's a very general marker, okay? Now, T3 and T4, the amount of bound and unbound hormone, shows mostly how much hormone the thyroid makes. It's ideal to be in the top half of the reference range for the T3 and T4. It's low with hypothyroid, it's high with hyperthyroid. Now, free T3 and free T4, this is the amount of unbound hormone and available for use. Okay. And again, you want to be in that top half of the range. Again, it's going to be low with hypothyroid and high with hyperthyroid. Now, T uptake is often what it's listed at on lab tests, but it's resin T3 uptake measures the amount of binding sites for free T3, which is needed. You need sites for T3 to bind to so the hormone can actually communicate the message it's intending to communicate in your body. Okay. And here we go. Low resin or low T uptake means more sites are open and available versus a high T uptake means less sites are available and open. Now, cortisol, we talked about that a little bit, the adrenal stress hormone, and secreted by the adrenal glands. It can actually lower TSH through the hypothalamus pituitary axis. It can block the conversion of T4 to T3. Okay, if that's happening, it's going to increase your TSH. Higher in the morning, lower in the afternoon. So here we go. Thyroid binding globulin, protein that binds and carries T3 and T4 in the blood, made in the liver. 25% saturation is normal. Estrogen or birth control and HRT can increase thyroid binding globulin. Low testosterone can increase thyroid binding globulin. Thyroid peroxidase antibodies, sign of inflammation. Same thing with thyroid globulin antibodies. It's an immune problem, but also it's a sign of inflammation. Let's see here. It can either be found in either Hashimoto's or Graves. Now we have reverse T3, blocks the conversion of T4 to T3. It increases in times of physical and mental stress. So it might not actually even be an immune problem or a thyroid problem, but more of a physical or mental stress. Imagine somebody that's training for, say, a marathon or triathlon, ultra marathons, right? Or something that's under a lot of mental stress. Maybe they're going through divorce or there's a lot of stress at work. This can definitely influence that reverse T3. Also, vaccines can increase the reverse T3 as well. It competes for the T3 binding sites. Symptoms of hypothyroid with normal TSH and T4 can be seen. Now, ferritin, the protein that stores iron. Iron impacts thyroid peroxidase activity. It's needed for thyroid hormone production as well. It makes iodine uptake more efficient. Aids in the T4, T3 conversion. It can get stuck in the gut lining with GI issues, and especially like gut inflammation and leaky gut issues, especially when there's the bad bacteria, yeast, maybe even a parasite. Uh, let's see, went the wrong way there. D3. D3 is another super important marker, or just vitamin D is super important marker to get measured. Ideally, this number should be at least 60 to 90, especially if somebody has an autoimmune condition. And here's a kicker. You need to make sure D3 is paired with K2, or else if you have too much vitamin D in your body without the K2, it will pull calcium out of the bones and it can get lodged in the thyroid as like thyroid nodules. For oftentimes for women, they could start peeing more calcium out, and that could lead to osteoporosis, or it could get lodged in the kidneys and cause kidney stones. So if you're taking a D3, you want to make sure it has the K2 with it. So here's the 4 questions again that you need to make sure are answered if you're told you have a thyroid problem. Is your body making enough? Does it have what it needs to convert? Is it being destroyed? Is there interference? Okay, that needs to be addressed. Now, here's some general health tips that I want to leave you. Take a screenshot of this as you're watching this. That way you can use it and reference it in the near future. But all these things are going to be really beneficial for about 99.9% of everybody out there. Okay. One other thing I'm going to give you. Take a screenshot, go to this QR code in the landing page. There's a ton of great free resources here to help you on your health journey to ask better questions of your providers, to find some resources with research to back up what we're talking about here. So what causes inflammation in your body? Inflammation leads to pretty much all disease, right? And you can see right down here, uh, whether it's unexpected weight loss, cancer, infertility, thyroid disease, arthritis, type 2 diabetes, autoimmune conditions, hormone imbalances. A lot of times it's inflammation that's leading the charge, causing these problems. It can come from physical traumas, chemical toxins, mental thoughts. We can think ourselves sick. And so who wants to live to be 94? If you don't want to live to be 94 or older, why not? Many people, when I ask this question to, like, quality of life, I don't want to be a vegetable. Like, my physically, I'm able to do things, but mentally, I'm there. I'm in la la land. Or I have a good mind, but my body's falling apart. So the question is, if you're going to live to be 94 or older, when's the best time to get healthy? Some people say now or tomorrow, and some people say yesterday. I like the yesterday one because you need to get going. The sooner, the better. You want to be around for your kids, your loved ones. You want to enjoy a high quality of life and not be suffering. So, with that, if you're watching this, I need you to screenshot this, reach out to us today, whether it's an email, you can send an email to South Denver at thewellnessway.com. Say you watch the thyroid presentation and you want to take advantage of the $99 special. But this would be the intake. We're going to look at any past labs you have and find where the holes are in those labs and what you have going on to make sure we get the right information so we can get test ordered that will give us objective information to find what the triggers are so we can address those triggers so we can start healing your body, decreasing inflammation, allowing your body to actually start healing itself. That sounds like what you're looking for. Reach out to us. Again, my name is Dr. Isaac with the Wellness Way of South Denver. Reach out to us today. You can give us a call at 303-399-3569, and we're here to help and serve you. Thank you.